streaming to Facebook, YouTube, and Instagram this evening. Let me know if y'all would like to add another platform. I'm thinking about it, but y'all let me know if you'd like for me to add LinkedIn to that. Let me know what you think about it. That's a possibility now. Thank you for your kind comment there. Okay, so this evening's topic is, could lymphedema be lurking in your future? All right, and we are going to get ready to begin. So for those of you that may not be familiar with me, I am Dr. Felicia, physiotherapist, a certified health coach, and I help women that are ready for change get off the hamster wheel of fad dieting and get consistent with movement and eating food that is good to and for their bodies. I have been in healthcare for going on 10 years now. Hard for me to believe that, but it is true. It's been almost 10 years now in health and wellness. And I'm the proprietor of Adderley Physiotherapy on Mackey Street in the Mackey Street Plaza. Okay, and that's across from Commonwealth Bank Plaza, if you're not familiar. And there I have treated hundreds of patients over the years. It's been 6 years now. I have treated hundreds of patients and helped them to reach their physiotherapy goals. As a matter of fact, today is World Physiotherapy or Physical Therapy Day, depending on what country that you are in. So kudos to all of the physiotherapists or physical therapists around the world that make it happen and help their patients on a daily basis. So let's see just a little bit more about what I do. Since certifying as a health coach, I do hope to help thousands more women, expanding my reach to online so that is not limited to just who I can help here in the Bahamas. I can now help persons that are pretty much located anywhere in the world through health coaching, right? So that women can live their best lives and live to see their fabulous futures that are free from debilitating diseases, right? So not dealing with all these lifestyle diseases. Okay. All right. Wonderful. Okay, so let's go ahead and jump into our material. So any information that I do discuss in this broadcast, it is not meant to be taken as medical advice. I don't know the specifics of anybody's case or medical history. So please do make sure that you speak with your primary care physician before you would make any changes to your eating or movement regime. Okay, so let's jump in. So we're talking about lymphedema this evening. I am also a certified lymphedema therapist, in case you were not aware of that. Okay, so lymphedema is a area that is near and dear, and I am anxious to use my skills to help even more and more cancer survivors. So I'm here to give some information that, hey, persons may not otherwise have. Lymphedema statistics. Gotta love those stats. So 2 to 3 million people worldwide have lymphedema. 2 to 3 million people. Secondary lymphedema specifically affects 1 in 1,000 Americans. So lymphedema has different forms: primary lymphedema and secondary lymphedema. Secondary lymphedema is basically the lymphedema that occurs due to some type of trauma. Primary lymphedema would be something that a person could be born with or congenital. So what exactly is lymphedema? It's a word that some people may not be familiar with, so let's define it. It's an abnormal accumulation of protein-rich fluid in the tissues, okay? The key word there is protein, or term is protein-rich, okay? So not just fluid, but the fluid has protein in it. Keep that in the back of your mind, because protein should not stay in your tissues. It doesn't belong there, okay? Shouldn't stay there. So that's going to be important in a few minutes, and I'll tell you why. So, what makes up the lymphatic system? You've got your lymph vessels or collectors, you've got lymph nodes, and you've got this lymph, this fluid that is flowing through the lymphatic system. Lymph usually is clear, okay, unless it has fat inside of it, then it has like a white or like milky looking appearance, okay? So that's what lymph is. So that's a fluid. So just like blood flows through your veins, lymph flows through the lymphatic system. Why is the lymphatic system important? And why it's important is because it drains substances that cannot otherwise be drained or reabsorbed by the blood system. So the lymphatic system is actually a filtration system, and it helps to drain fluid after surgery. So this is why manual lymph drainage has implications other than just with cancer treatment. It can actually be utilized with things like ankle sprain or post-surgical swelling, like if a person had knee surgery. Okay, so all of those are implications in which manual lymph drainage, one part of the full treatment for lymphedema, its other implications that it can be used in other conditions, which it can help. Very helpful. So if it's a swollen hand, okay, a swollen shoulder, there are so many implications. So basically anywhere that there is swelling, once there are no contraindications, then manual lymph drainage is appropriate. So of course the clinician or whoever is performing this lymphatic drainage, they would have to be aware of what the conditions are under which it is appropriate to administer the treatment and the conditions under which it is not. Okay, so there are always do's and don'ts in the healthcare profession, and it's important to know what they are. So, what goes wrong and then leads to lymphedema? So we said that the protein-rich fluid is in the tissues. Protein isn't supposed to stay there. So what happens is if that protein is there hanging out in the tissues, then what it does is protein is water loving. So it's going to keep pulling more and more water through osmosis. Okay, if you remember that term from your high school days, it's going to keep pulling more and more water towards itself. Okay, and that is how that fluid then starts to build up, build up, build up. More and more water is coming into the tissues. And then that is what causes the appearance of this swelling. So this fluid is actually supposed to be recycled back into the bloodstream. But that's not going to happen if the protein is in the wrong place. And then it just continues pulling and pulling and pulling more fluid. So this is a problem. So the lymphatic system is actually responsible for the removal of the protein from the tissues. Okay, so it's not supposed to stay there. It's supposed to get filtered back out by the lymphatic system. But when there is damage, which could be to either the lymphatic collectors, it could be damage to the lymph nodes themselves being removed. So what can happen oftentimes, and this can be with breast cancer, prostate cancer. This can be with pretty much any type of cancer. So if there is a removal via surgery of the lymph nodes, and it doesn't have to be all of them, it can just be some, okay? Because they're necessary for this system to work correctly. They're a very important part of it. So what happens is if some of the lymph nodes are removed or some of the lymph collectors, you can think of them as the equivalent to blood vessels, okay? Then what happens is that is going to cause a overworking of the system. An example that I like to use is if you think about a workplace, okay? Think about maybe even one of our government ministries. Imagine that half the department or 3/4 of the department goes on vacation at the same time. Everything is going to start moving very slowly, right? There are going to be some clogs, okay, in the pipelines. It's just not going to work as efficiently. And that's how you can think of the lymphatic system and the lymph nodes. If each person is a lymph node, right? And some of those lymph nodes go away for whatever reason. Okay, now what can also happen is that there is Radiation treatment, that's another treatment for cancer, a common treatment. And what can happen is that can also cause damage to the lymph nodes. So now after cancer survivors get these treatment, get rid of the cancer. Whew, okay, dodged a bullet, right? Then now they go back to their lives. And then what happens is, okay, they have these few lymph nodes left, and now they're overworked. They're overworked. And this goes on now weeks, months, could be even years, because lymphedema does not have to show up in the first year. It, in most occurrences, it shows up within the first year, but it could literally be years later. It could be even 3 to 5 years after having the cancer treatment. Okay. So then what can occur is, they start to then have this like overworked, that the lymphatic department is overworked. Okay. Then the remaining workers go on strike, lymph nodes in this case. Okay. They go on strike. They call their union representative and they go on strike. Okay. And then it's like, okay, well, nobody is working now. We're overworked. We're not going to take this anymore. So they go on strike. And then what happens? The work, or the lymph fluid, gets backed up, backed up, backed up, backed up. Okay. Now, normally the lymphatic system will get rid of that protein, like we said, okay, or the workload. The protein is the workload, okay? But if the lymphatic system is not functioning, then you have to go towards getting treatment. There isn't actually a way to cure lymphedema, okay? And I'm going to get to this at the end. I've got like some just little like facts for you at the end, and basically take home points. And then we'll have a chat about, well, hey, how do you get this protein out of there, right? Because the protein is the problem. If you get the protein out, then you get the fluid out, right? Okay. So what types of cancer are actually associated with developing lymphedema? It can be really any type of cancer in which the lymph nodes are damaged in any way, or even the lymphatic vessels. If it is a surgery, the lymph collectors or vessels can actually be cut in the process of the surgery. It can't really be avoided, okay? And then lymph nodes could be removed. Okay, so that kind of thing. And anytime that is involved, any assault on the lymphatic system, it could even be due to the tumor itself growing in a part of the lymphatic system and causing a blockage. Okay, so like a roadblock, and they put up the roadblock and then the cars can't get through. You got to go through slow, 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 one by one. That's what happens. So it could be breast cancer. It happens most often in breast cancer, but it is not the only possibility. So it could be breast cancer. It could be head and neck cancers. It could be uterine cancer, prostate cancer. So vulvar cancer, ovarian cancer. In those cases, then the person would have the lymph nodes removed from the inguinal or the groin area. Okay. And also lymphoma and melanoma. Now, when you think about what is the location of most of our lymph nodes, they're the most highly concentrated under the arm, so the armpit or the axilla, in the groin or the inguinal area. You also have a few under the chin here. So, when you go to the doctor and you tell them you have a cold and they come and they feel under here, then they're feeling to see if you have any swollen lymph nodes, because the lymph nodes are also an important part of like our immune response. They filter out it's responsible for filtering out like foreign particles. I've always found it so interesting that tattoo ink is one of the things that the lymph nodes will filter. Go figure. So the lymph nodes are a sieve, right? Filter out any harmful things, tar, dirt, things that we may inhale. So our lymphatic system is actually really important, okay? So you also have more lymph nodes here above the collarbone, okay? So those are some of them. And then the rest are just kind of sprinkled, a dash throughout the rest of the body. And you have about 600 to 700 lymph nodes in total. It's important to note that when you have that burnout situation of the lymph nodes, they do not regenerate. So if lymph nodes are removed, if lymph nodes burn out, you can't hire new lymph nodes like how you can hire new staff. Okay. That's it, kaput. What you get when you're born, that's what you have. Okay, it's no regeneration. It's not like the liver that, you can take a piece and regrow it. I think that's fabulous about the liver, by the way. But they cannot bounce back. That is it. Okay? When they're gone, they are gone. Okay. So I'll take a little celebrity break here. So this is our celebrity, TEA, our celebrity break, okay? And I've mentioned this one particular person before, this one celebrity, very well known, and that's Wendy Williams, and very vocal about her lymphedema. And I was looking to see who are some other celebrities. And very interesting, I did come across an article that stated the only name they really called was Ingrid Bergman. And she passed away, I want to say, in the 80s. And she was the only one that was really like vocal about having lymphedema like that, because basically it's people don't want other persons to know, particularly celebrities. They don't want people or the world to know that they have this disease. So there is really a stigma attached to it, particularly, well, I think for any cancer survivor, really, because of the aesthetics. You're walking around and you have this sleeve on, so it's very obvious that, hey, something is wrong, something is occurring, this person is going through something. For people in Hollywood, their appearance is everything. So to say, well, I have lymphedema, could be career ending. So it's interesting that, and you will hear very often about celebrities that have cancer, even breast cancer a lot of the time. And so with this high incidence, 1 in 1,000 Americans get secondary lymphedema, they're not admitting that clearly quite a few of them must have lymphedema, but they are not publicly admitting it. Very, very interesting. And then as that fluid is building up, so basically if a person has had left-sided breast cancer and they get lymphedema, it would also then be on that left side or left arm, and that left arm is going to swell. And if it is not treated, then it is going to continue to swell, and then they end up with one arm visibly bigger than the other. And you know how Hollywood is, where are they going to cast people in movies? It's awful, but this is really how I suppose the actors and actresses have to think. Like, I can't let anybody know, because it's basically going to like put a full stop on their acting career. Interesting. So kudos to the ones that are brave enough to come out and say and really advocate for the diseases that they have, because the advocacy makes a huge difference. There are many people, even in healthcare, that pretend that they stick their head in the sand and they act like lymphedema is not a real disease. Like, this is not a real thing. We're going to just ignore this and pretend that this is not happening, and not refer persons on for the correct care. And this is just, I'm speaking in like generalities. And if you research this, you will find that this is the case. They're still talking about this online. You have persons that are advocating, that are into like lymphedema education. They are advocating, and persons like myself that want to put the word out, because it is really, really and truly like still mind-boggling that people, they're cancer survivors and they didn't even know to look out for these symptoms or treatment. So it's so important to get the information out to the persons that really, really need to have it. Okay. At the moment, there is just no way to regrow or regenerate lymph nodes or anything of that kind. Stem cell research, perhaps in the future. We don't have like anything right now. There is no recourse for when those lymph nodes are cut away or burnt out, damaged from radiation, or just being overworked. Okay, there's just no recourse. There's nothing nothing that can be done. And hello, Shannon Peyton. Thanks for popping in. All right, so How does a person or a cancer survivor lower the risk of getting lymphedema? So, what they can actually do, I've got a few tips here for you. So, if you are a cancer survivor or you know a cancer survivor, this is still a good time to go ahead and tag them in the comments, or you could even send them this live later so that they can get this information, because trust me, they need it. If there's anything that a person could do to stop themselves from getting this disease, lymphedema, that they cannot get rid of. Once you get lymphedema, you will not get rid of it. You can only treat it. Okay. So if there's something that we can do to help others, then let's lend that helping hand by giving them this information. So one thing they can do, wear a compression sleeve for airplane travel. Okay. If anybody needs to be measured for a sleeve, you can see me about it. Okay. Just go ahead and send me a DM or a private message, and I will go ahead and see about getting you in for that measurement and ordering in a special sleeve for you. If it needs to be custom ordered, you can do that as well. But you want the sleeve to always be a good fit. Okay. It needs to be snug enough so that it can actually do its job. Okay. Not too tight that it's a tourniquet, but we need it to be snug enough. Okay. Of course, we know that cabin pressure changes. Okay. So it puts a person that is at risk for lymphedema, that's a cancer survivor. Second thing that a person should do to avoid lymphedema is avoid extremely hot temperatures. So maybe not extremely hot, like don't go in the hot tub. If you're in a hot region, there's little that you can do about that. But, you don't necessarily have to go in a hot tub. Or you could, kind of like wear clothing that would actually cover the extremities so that they're not exposed to direct heat, that kind of thing. Not extremely hot baths, showers, because it makes a person's incidence of developing the lymphedema higher. Hot packs, that kind of thing on the affected arm. Now the rest of your body, it's okay, but you don't, like, if you had back pain, you could put a heating pad on your back. You just don't want to put it on the affected limb, or if it was a head and neck cancer, over those areas. Another thing that a person should do if they're trying to avoid lymphedema and they are a cancer survivor, they should wear loose clothing around the area that's at risk. So if it was their leg, they shouldn't wear pants that are too tight. What's the thing that's in now? Hoochie daddy shorts. If you had prostate cancer and they, gave you some radiation, okay? If you had ovarian cancer, okay, maybe not the tightest of short shorts, okay? Loose fitting, let the leg breathe. If you have, maybe an upper extremity at risk, don't wear shirts with sleeves that are too tight. Okay. Think loose fitting and flowy. Best option. So also don't allow persons to take blood pressures on that arm. Okay. Needle sticks or pricks. Those are also going to kind of open you up more so to developing lymphedema. So, the Lord bless us with two arms. So if they remove lymph nodes on the left, have your blood pressure taken on the right. Okay? And also, as well as you can, try to avoid insect bites. So if that means that, when you're going to be outside, you have to burn your mosquito coil. If you're in the Bahamas and you're going to be visiting one of our family islands, make sure that you have your mosquito repellent, okay? You don't want to be getting all bitten up and then be compromised, okay? You want to take really, really good care of your skin and all of that, avoiding like cracks and things like that. Okay, so those were some of my tips, okay? Just some. If you wanted more strategies, if someone was a cancer survivor and they need to meet with me to give it the rundown. And I recognize that what happens a lot of the time, people may be given this information, but once you hear that, if you walk into the doctor's office and you hear that you have cancer, I don't know if you hear anything else after that. So it's kind of like main thing on the agenda, get rid of this cancer and save this person's life. That is the main thing on the agenda. and then the lymphedema and looking out for that, I can understand how that would become secondary at that time. But don't forget, you have healthcare professionals like myself that specialize in this area, and we're here to help. So we're here to give you the information that you need, answer your questions. Okay, if we need to allay your fears a little bit, and then we're here to check in with you along the way. All right, so we're here to help and we're here to go along with you on the journey. And the certified lymphedema therapist is an important part of the healthcare team and the oncology team. Okay, so remember to utilize what are the resources and who are the resources that you have available to you. So, hey, come in for a consultation when you get that diagnosis. You come in, you get your strategies, you get the way forward. Sometimes just feeling empowered and having knowledge can maybe even help you feel a little bit more in control of the situation and just like, okay, I can get through this. I can do this. So here's a few things that you should know. Things you should know. Is it enough to just wear a sleeve if a person already has lymphedema? No. If a person has lymphedema, they need the full, complete decongestive therapy treatment. That is the name of the treatment that is appropriate for lymphedema. Taking one part out is not wise. What's going to happen? So if a person then wears a sleeve, remember we talked about this protein. The protein is stuck. The protein is stuck. So a person says, okay, well, I'm just going to go and I have lymphedema. I'm just going to buy a over-the-counter sleeve and put that on. First of all, sleeve is possibly not fitting correctly. Okay, that's already like one problem. Then, you're just wearing this sleeve. So all you're doing is just squeezing the arm. The arm is getting squeezed, but there was no manual lymph drainage. So basically it's going to get stuck right here. Remember the roadblock? The roadblock is still there. What the manual lymph drainage does is it creates like a system you reroute. So because it's burnt out here, we reroute. So as a therapist, we basically would have to sometimes design a specific treatment protocol according to the patient's history, because we have patients that come in with all kinds of things. And so the one size fits all doesn't work. Okay, so you have to design something that is specific to that patient because people have different situations. So what has to occur is that you have to reroute, you have to take a detour. Okay, these lymph nodes can't help you. So squeezing the fluid toward these lymph nodes that are on strike, it's no help. Okay, so you need that manual lymph drainage, one part of the complete decongestive therapy, right? Compression is one part, but you can't only do the compression. You want all four of the parts, okay? And then that will help you reroute the fluid, okay? That's how the protein is going to get out now, okay? So you want to reroute the protein-rich fluid out of that arm and over to the areas that have the other lymph nodes that can handle it. Okay, so that's like getting the other departments at the ministry to help out. Okay, if we go back to our original example. So just wearing a sleeve, not going to be effective. Okay, so try not to, think of that as, oh, a shortcut or a quick fix. There is no quick fix with lymphedema treatment. So the lymphatic system, I thought this was just so interesting. The lymphatic system, like most of our body systems, they overlap with several other systems. So no system or no man is an island. No system is like unto itself in the body. So interesting. And I was just like making so much connections with like this new certification that I am working on. And it was talking about the same concept, like these systems, they overlap. And, you don't always really stop and think about it, but the lymphatic system overlaps with the digestive system because, hey, how'd the protein get there in the lymphatic system, right? Very, very interesting. So, and then also there's a nervous system overlap or response as well. So it overlaps with the nervous system and the digestive system. the lymphatic system does. All right. Very interesting. I don't know if anybody ever gets just amazed at how we are made, how we're so well put together. Like, how is this possible? And then so many of us walking around so fearfully and wonderfully made. It's really amazing. Okay, so I've said this already. There is no cure. No cure, no cure. Okay. People ask, can we get surgery for lymphedema? No, there isn't any like wildly successful surgery at this point. They're toying around with some things. Nothing is like wildly successful yet because, of course, everybody would be running to get that if there was, you know. They have machines available also that can be used, but the machine by itself isn't an appropriate treatment unto itself. Okay. The machine is more appropriate for after a person has received the full treatment from a certified lymphedema therapist. And then like that's a part of their home management or maintenance after, or it could be. You don't have to buy a machine, but some people like to. Okay. A person has to be self-sufficient by the time they get to the end of the course of physiotherapy treatment. Okay. They have to know how to manage their own condition. Okay. They have to be able to do it. It's a commitment. It's every day. You know, it just has to become a part of your daily routine. You know, we're all about routines here. Okay, at I am Dr. Felicia, right? So what happens is without the treatment, then the protein just sits there. Fluid keeps moving into the tissues, so the swelling becomes bigger and bigger and bigger, bigger and bigger and bigger. Okay, and then this becomes an issue for the cells to get their nutrients because now there's a further distance between the nutrients and where the cells are because all of this swelling is there, growing and growing and growing and growing. Okay, then you're going to start to have some other problems. So it's going to be more than just a swollen arm, leg, or face. Then you're going to have to start having some serious problems with some of the other body systems, right? Our cells not being able to get nutrients is a big issue. All right. So lymphedema is bad news, bad news due to that fact. Okay. Because then the nutrition is going to be affected. So you kind of see how everything like overlaps, right? But there is treatment available to help. No cure, but treatment. Okay. And that is the complete decongestive therapy. So feel free if you need further assist from me or someone that you may know or love that needs this information. There's much that you can do. Okay. Please don't sit on this information. Okay. Information and knowledge, applied knowledge is power. So don't sit on this live stream and don't sit on this information. Share it with someone. Share it with someone that you know that it could help. Okay. Share it with someone that you don't know that it could help because, like we said, people either may not be aware of lymphedema or they may have it and not be willing to let anybody know that they do have it and maybe not even getting help for it. So please do share. Places to find me, okay, on all of your favorite platforms, on Instagram at I am Dr. Felicia, on YouTube at I am Dr. Felicia, on Facebook, Adderley Physiotherapy until further notice. Let's see, also on Pinterest, still Adderley Physiotherapy there. Also on TikTok at I am Dr. Felicia. Okay. Did I miss anything? Let me know if I missed anything. I'm on LinkedIn. I'm on LinkedIn as just me, just still the same OG. Okay, I'm on there as Felicia Adderley. Okay, feel free to connect with me over there. And if you would like me to do more on LinkedIn, then please let me know that as well. We're going to keep building things over here at I am Dr. Felicia. We're going to keep moving forward. Lots of exciting things coming. I love how you all have been getting interested in the polls and responding to the polls. That's very invaluable information that you are providing to me. And it actually gives you the opportunity to be a part of what we're building here. Okay, so we're building a community of women that want to lead healthier lives and have a better quality of life way into our 60s, 70s, 80s, and beyond. So come on in, grow with me. The water is nice, okay? So much more planned and in store for you all. Make sure that you let other persons know about it too. If you're enjoying this community, don't keep it to yourself. Share it with the people that you know and love so that they can be fabulous too. All right. And be sure that you always give me your feedback so that I know what it is that I can add to the community to continue to improve it. All right, y'all. So I don't see any further questions in the comments. I believe that I answered questions as I was going along. If you have any other questions that you can think of right now, please do go ahead and put them in the question queue over on Instagram or on the comment section if you are on Facebook or YouTube. I see the questions on YouTube in real time as well. Someone says that they shared. Thank you so much. All right. So if there are no further questions at this time, this is Dr. Felicia signing off. Okay, I faked you out. Okay. Don't forget to come back next week, same time. Same time, same channels, y'all. It's also Yoga Awareness Month, and we're going to be talking about that next week. I may just have a special guest for us. So join us. Okay. So we having a guest come in our house, y'all. We have to, give them a good reception. So bring a friend next week. Okay. We're going to talk about Yoga Awareness Month and how great yoga is for our health, our mind, our bodies, spiritually, mind, body, soul, spirit connection. All right. So don't miss it. Okay. So now I'm really signing off. This is Dr. Felicia signing off for the evening, making the world healthier, one woman at a time. Bye. See you all next week.